This is chapter 3, Gastrointestinal System. Question number 1. 12-week pregnant patient. Ultrasound shows 1.5 cm well-defined hypertrophic lobular and homogeneous in the right lobe of the liver. Doppler ultrasound shows no signal diagnosis causes hemangioma. There is a simple ultrasound shows 1.5 cm well-defined hypertrophic homogeneous lesion in the right lobe of the liver, and in pregnancy seen is most common seen in pregnancy. And on Doppler ultrasound there is no signal. Sometimes also shows no signal on Doppler ultrasound diagnosis hemangioma. Okay, this is an image of hemangioma, and it has diagnosed hemangioma. Centripetal filling on quad phase CT scan shows centripetal filling. Centripetal. Next question number 2. ERCP shows generalized dilated intrahepatic and extrahepatic duct with multifocal strictures and small diverticular formation, primary sclerosing cholangitis. The Caroli's disease, primary sclerosing cholangitis. ERCP shows generalized dilated intra and extrahepatic ducts with multifocal strictures and small diverticular formation, diagnosis by primary sclerosing cholangitis. GRCP shows generalized dilated intra and extrahepatic ducts with multifocal strictures and small diverticular formation, diagnosis primary sclerosing cholangitis. Question number 3. Mucocutaneous pigmentation on the hands and feet has iron deficiency anemia, radiograph to small bowel obstruction. Contrast enhanced CT shows general interoception, diagnosis Peutz-Jeghers syndrome. The Peutz-Jeghers syndrome. The rectal polyp. Okay, so pigmentation, mucocutaneous pigmentation on hands and feet. Patient has iron deficiency anemia. On contrast, enhanced CT, there is seen general interoception or multiple polyps seen, diagnosis Peutz-Jeghers syndrome. Again, this is polyposis syndrome. This is question number 4. Right upper quadrant pain. Pain has skin lesion excited by dermatologist, which most likely is skin cancer, multiple enhancing lesions in the liver, a marriage with multiple homogeneous hepatic lesions with increasing intensity on T1, increase high on T1, melanoma, malignant melanoma, hepatic metastasis. So patient had skin lesion excited by dermatologist and then multiple enhancing lesions in the liver and high on T1, diagnosis malignant melanoma with hepatic metastasis. Question number 6. Man with history of multiple scalp lesions and dental caries. CT scan shows extensive colonic lesions and a duodenal mass causing partial obstruction. Familial epidermolysis polyposis with scalp lesions. So, man, when we look at scalp lesions, FAP, femoral okay. Now, there is also Tract syndrome, with a brain tumor seen in Tract syndrome, and Peutz-Jeghers syndrome shows mucocutaneous pigmentation, and Gardner syndrome shows osteomas and fibromas. So, patient has multiple scalp lesions and dental caries. CT scan shows extensive colonic lesions and a duodenal mass causing partial obstruction. Diagnosis familial epidermolysis polyposis due to scalp lesions. These scalp lesions are not necessarily tumors, so diagnosis familial epidermolysis polyposis. Number 7. We repaired renal cell carcinoma, which has to spread into the perinephric fat and angiomyolipoma with hemorrhage. The best diagnostic modality would be CT scan for the fat. CT scan to see the fat. Now, to repair renal cell carcinoma and angiomyolipoma with hemorrhage, best diagnostic modality would be CT scan. The CT scan will show us fat, hypodense on fat. Low Hounsfield unit will be seen in fat lesions. So it will, if there is fat present, it will be angiomyolipoma. If no fat present, then renal cell carcinoma. Question number 8. A history of recurrent episodes of loss of consciousness, enhancing mass in the pancreas, diagnosed insulinoma. Now, history of multiple episodes of loss of consciousness, enhancing mass in the head of the pancreas, diagnosed insulinoma. Insulinoma is the most common tumor seen in the head of the pancreas compared to glycogonoma, and insulinoma is seen in the head. Most likely, glycogonoma is seen in the tail and body. So, enhancing mass in the head of the pancreas, diagnosed insulinoma. Enhancing mass in the head of the pancreas, diagnosed insulinoma. Question 9. Investigation is the most sensitive test for localization of islet cell tumor or arterial stimulation when sampling. Now, this is islet cell tumor pancreas, okay, with insulinoma. Investigation most sensitive test for localization of islet cell tumor arterial stimulation when sampling. Okay. Question number 10. Contraindication for ultrasound carrier liver biopsy is suspected hemangioma. Counter again for ultrasound guided liver biopsy is seen suspected hemangioma. Question number 12. Lower abdominal pain, 2 cm fat lesion, density lesion surrounded by hypertensive rim and inflammatory fast training hypertensive mark on diagnosis, epiploic appendicitis. This is epiploic appendicitis. Lower abdominal pain, 2 cm fat density lesion surrounded by hypertensive rim, fat density lesion surrounded by hypertensive rim, and inflammatory fat stranding, apparent sigmoid colon, diagnosis, epiploic appendicitis. Fat density lesion with hyperdense rim and inflammatory fat stranding, impacting the sigmoid colon, diagnosis, epiploic appendicitis. Question number 13. Patient with insulin-dependent diabetes and hyperparathyroidism presents with renal colic. Okay, and then CT scan shows generalized increase in liver retention, amide with homocysteine signal loss in the liver on T2 cause hemochromatosis. No, low on MRI, low on T1 and T2 senin hemochromatosis. Low on T2 hemochromatosis. Patient with insulin-dependent diabetes and hyperparathyroidism presents with renal colic. CT scan shows generalized increase in liver retention, amide with homogeneous signal loss in the liver on T2 causes hemochromatosis. 14. Patient with weight loss and diarrhea. Family history: father had total colectomy at age of 21 years. Colonoscopy shows hundreds of polyps in the colon. Diagnosis: primary adenomatous polyposis. The parent had family history. Father had a total colectomy at the age of 21 years. Colonoscopy shows hundreds of polyps in the colon. Diagnosis: primary adenomatous polyposis. Number 15. Mother ordered contraceptive abdominal pain. 3 cm well-defined lesion in the right lobe of the liver that is homogeneous except for seminal scar. Diagnosis: focal nerve hyperplasia. Focal nerve hyperplasia and fibrolamellar carcinoma, right? Focal nerve hyperplasia will show hyperintense scar on delayed phase. On delayed phase, it will show hyperintense scar. So, 3 cm well-defined lesion in the right lobe of the liver, there is homogeneous except for central scar. 3 cm well-defined lesion in the right lobe of the liver, homogeneous except for central scar, and with focal nerve hyperplasia. 16. Okay. Incidental 3 cm hypochoric lesion in the spleen, isointensive to spleen on T1 and bright on T2 with gadolinium centripetal pattern enhancement, hemangioma. Now notice that it is splenic hemangioma, this is liver hemangioma. My point thing is on centripetal pattern enhancement seen in hemangioma. Centripetal pattern enhancement seen in hemangioma. Question 17. History of aortic valve replacement, bleeding per rectum on arteriography, cluster of vessels on the antemesenteric border of the ascending colon with early of the colic vein, diagnosis, angiodysplasia. Now this is all angiodysplasia of colon. Okay. Now on history of aortic valve replacement, bleeding per rectum, arteriography or CT scan, cluster of vessels on antemesenteric border of the ascending colon with cluster of vessels on antemesenteric border of the ascending colon with early of the colic vein, diagnosis, angiodysplasia. Question number 18. CT scan of thickened gastric wall with prominent mucosal fold affecting the upper part of the stomach and greater curvature, while the antrum, pylorus, and rest of the body appear normal, diagnosis, material disease. Now, CT scan shows thickened gastric wall with prominent mucosal folds affecting the upper part of the stomach and greater curvature, while antrum, pylorus, and rest of the body appear normal, diagnosis, material disease. These are folds, but in the lower stomach appears nearly normal, but there is still thickened mucosal folds. So, CT scan shows thickened gastric wall with prominent mucosal fold affecting the upper part of the stomach and greater curvature, while antrum, pylorus, and the rest of the bowel appear normal. Diagnosis and material disease. Question 23. Road travel accident, fat stranding on the small bowel mesentery. Small amount of fluid between the small bowel folds with osmolality of 75. Diagnosis, mesenteric hematoma. Okay, this is mesenteric entry. The road travel accident, fat stranding in the small bowel mesentery. Now, fat stranding in the small bowel mesentery and small amount of fluid between the small bowel folds with the osmolality of 75. Diagnosis, mesenteric hematoma. Now, fat stranding in the small bowel mesentery with a small amount of fluid between the small bowel folds. Diagnosis, mesenteric hematoma. Now, fat stranding in the small bowel mesentery, fat stranding with small amount of fluid between the small bowel folds, diagnosis mesenteric hematoma or mesenteric injury. Ultrasound shows there are multiple echogenic intramural foci with common tail reverberating artifact. Most likely cause of the reverberation artifact is adenomyosis in the gallbladder. Ultrasound shows in the gallbladder there are multiple echogenic intramural foci with common tail reverberating artifact. Most likely cause of reverberating artifact diagnosis adenomyosis. Ultrasound there are multiple echogenic intramural foci with common tail reverberating artifact. Diagnosis adenomyosis. 27. CT abdomen shows a homogeneous extraluminal mass with heterogeneous enhancement and low attenuation center arising from greater curvature of stomach. PET scan shows markedly increased glucose uptake by the lesion. Diagnosis gastrointestinal stromal tumor. This one hint is that it shows markedly increased glucose uptake, so it's gastrointestinal stromal tumor. Because one is this hint, another is that CT abdomen shows a homogeneous extraluminal mass with heterogeneous enhancement and a low attenuation center. The low attenuation center arising from greater curvature of stomach, but here and diagnosis gastrointestinal stromal tumor. Now, CT abdomen shows homogeneous extraluminal mass with heterogeneous enhancement and low attenuation center arising from greater curvature of stomach, diagnosis gastrointestinal stromal tumor. And PET scan it shows markedly increased glucose uptake. The duodenal gastrointestinal stromal tumor. Again, this scan shows homogeneous extraluminal mass with heterogeneous enhancement and low attenuation center arising from greater curvature of stomach. Here will be arising from duodenum. Diagnosis gastrointestinal stromal tumor.